Hello, my dear friends. This afternoon I'm going to talk about hyperkalemia after missed hemodialysis. I'm Henry Santiago Massa. I'm studying from Universidad Católica Santiago de Guayaquil, and this presentation was made for my medical English class, which doctor is John Moscoso. So to start with this topic, the hyperkalemia after missed hemodialysis, we're going to say some definitions about this. So, hemodialysis is the most common method to treat advanced and permanent renal failure. Since the 60s, when hemodialysis first became a practical treatment for kidney failure, we've learned a lot about how to make hemodialysis treatment more effective and how to minimize their side effects. Hyperkalemia is the high levels of plasmatic potassium. The normal range is 13 to 19 milligrams per deciliter. So we're going to see a video about hemodialysis, a video of hyperkalemia, and a video about the renal failure, which is a chronic disease. So to start, we're going to see this video about the renal failure.
Plasma when renal function declines. The calculation takes into account the patient's age, gender, and race. Symptoms develop slowly over time, progressing through renal insufficiency to
So as you could see, the renal failure is the end stage of progressive damage in the kidneys, and this is the time when hemodialysis is required to treat this disease.
Type filtering independence is a independence of the overall atrophic exocrine is a
So sorry about that. Continuing with this presentation, we're going to see a video, but I don't know why it's unavailable. But the main causes of hyperkalemia are because the renal function is damaged, and the potassium that is often dropped through urine it stays in blood, and the levels of this potassium increase, and this state is called hyperkalemia, that is over the normal range, that is 14 to 19. So continuing. So the application in the medicine, you're going to see that during the hemodialysis, 2 needles are inserted into your arm through the access site and attached with a tape in place to hold them firm. Each needle with tape in place to hold them firm. And I read it twice here. So each needle is attached to a flexible plastic tube that connects to a dialyzer. Through a tube, the dialyzer filters your blood in a few ounces or grams at a time and allows extra waste and liquids to pass from your blood to a cleaning fluid called dialysate. The filtered blood returns to your body through the second tube, as we saw in the before video.
There are 2 main types of dialysis. Which is essentially a large and strong needle, enough to sustain the flow without shedding. This is how you tremendous waste of electrolytes to pass through. Filtration occurs by osmosis and diffusion, where water and solids move from air to lower concentration. Dialysis fluid contains science at the level of particles in the blood.
the pros, we can see that this is used as a treatment in renal failure, and this do the kidneys function. And the cons are that it can occur blood infection, thrombosis, and internal bleeding caused by the administration of anticoagulants like heparin. Sorry about that. Again. And continuing with this, we're going to see this applied in Ecuador. In our country, there are dialysis centers located in Ecuador. And in some other countries, so you can travel to many areas and still receive hemodialysis according to the government. The dialysis team can help you make inquiries in other places, or you can communicate directly with the dialysis center at your destination. Plan ahead to make sure there is a space and make the right arrangement. In conclusion, we know that the kidneys do much more than eliminate waste and unnecessary fluid. They also produce hormones like erythropoietin and balance the body chemicals and the blood pH. When the kidneys stop working, you may have anemia, problems, and conditions that affect the bones, nerves, and skin. That's why in renal failure, the hemodialysis is very necessary and useful. An imbalance of electrolytes can occur, and it's where hemodialysis becomes important to regulate this imbalance, like as we saw the hyperkalemia. So thank you so much. Hope you enjoyed, and I hope you give it a like and comment. Thank you.